Good morning, everyone. Thank you for joining me this morning. I'm here with Lanette Siragusa, the Chief Integration Officer in Shared Health, but also, of course, a key leader in Manitoba at the Health Incident Command Structure, and a face and a name that you know well in Manitoba. Thank you for joining us, Lanette. Merci tout le monde d'avoir ici avec moi cet dimanche matin pour un sujet urgent ici à Manitoba. Manitobans know that we've been encouraging everyone to follow the fundamentals and keep each other safe at a time when COVID-19 case numbers are rising. And following the fundamentals is our best weapon against COVID-19. We know how incredibly serious COVID-19 is. We know that both in Manitoba and from following the rest of the world. We know that COVID and long-term care homes is exceptionally serious because of how susceptible the elderly are for morbidity and mortality and negative outcomes. And we have seen that recently. So I'm here today to provide an update on Maple's long-term care home and to provide information about where we are, what we've learned, and where we're going from here. I want to start by expressing my condolences to all of those who have lost a loved one to COVID-19. Everyone grieves in their own way, but COVID has taken a lot away from Manitobans. I want to also express condolences to those who lost a loved one at a long-term care home and those who recently lost a loved one at Maple's long-term care home. Yesterday, I became aware of the tragic events and situation at Maple's personal care home. As Manitobans now know, a call was made to paramedics from the home. Paramedics arrived to provide care and interventions to residents there. There were 3 people sent to hospital. There were 2 residents that had passed away before paramedics responded. One of whom had COVID-19. Others, as I say, were treated on site and remained at the facility. This was devastating news, and we know that it took a lot of people by surprise to think that paramedics were arriving at a long-term care home. We were troubled by what we heard. I was troubled by what I learned, and I immediately called for meetings. And I immediately called for a briefing, and then I immediately called for a notice to the public of what had taken place. And so because of that, yesterday we had representatives from Revera, the operator. We had Gina Trinidad from the Winnipeg Regional Health Authority Long-Term Care COO. And we had the Chief Medical Officer as well in the WRHA providing that information to Manitobans. I want Manitobans to know that in the 24 hours that have passed, I have personally contacted the President and CEO of Revera. I have personally contacted and spoke with the Chief of the WFPS to understand what that response entailed. I have personally spoke to the Executive Director of the Paramedics Association of Manitoba. I have reached out to Doctors Manitoba. I have reached out to the Federal Health Minister, and that conversation will take place later today. Pardon me, and I should say that yesterday when I said the CMO was on the call, I should indicate that was the WRHA Medical Director of Long-Term Care Program. Sorry for that. I want to recap the immediate actions that were taken and indicate that what happened yesterday after the fact is they were observing EMS assessments of residents and that the system leaders were conducting their own examinations. I want Manitobans to know that a nurse practitioner and medical director have been on site since yesterday. They are continuing to assess residents and provide medical intervention as necessary. A rapid response team that Manitobans heard first about yesterday was on site yesterday evening and provided care there again yesterday. And we'll speak a bit more about that and what that resource will provide right now in just a moment. And in addition to that, of course, immediate steps are taken at Maple's personal care home. All of these things are good, and they all indicate that people in charge are taking action. But it is clear to me, it is clear to our government, it is clear to our leaders at Health Incident Command Structure that more is necessary. Despite preparations, we have seen here the deadly consequences of COVID-19 in personal care homes. We know that the threat of COVID-19 is far greater for seniors, especially those who are in long-term care settings. We know that in Quebec and Ontario alone, over 7,000 care home residents passed away from COVID-19. And keeping COVID-19 out of our care homes has been one of the greatest challenges and one of the greatest areas of focus of system leaders and the entire team during this pandemic. So as I said, more clearly needs to be done. I can tell everyone that behind the scenes, there are a lot of people undertaking to understand more what occurred at Maples, what changed so very quickly that it was necessary to call paramedics. How can we avoid similar situations in the future? Were the right people at the right place at the right moment? And what do we do to make sure that other personal care home settings are appropriately responding? We're being told by those on site that they're seeing things in terms of the condition of patients that they've never seen before in their careers, about the acceleration of that deterioration of the condition of the patient towards the end. And that needs to be more clearly understood. But what we all need to understand is that right now Manitobans, they need answers. They need reassurances, and they deserve to have those. So I want to speak just in my time here about the things that we will do immediately in order to understand better what has occurred and how we lead from here. Because our government's #1 priority is to protect Manitobans, and we will do everything in our power to do so. These are the actions that I will take as minister following the information that I've learned 24 hours ago. And #1, I want Manitobans to know that at this point in time, the response of the system in such a case like this is to undertake a case summary, to assess what the care was that was being provided by the operator, in this case at Maples Long-Term Care Home. They will assess the conditions of the patients as recorded in the charts, the care provided, the frequency of the interventions, and they will seek to understand by doing so what was done, if it met the test of being medically appropriate, and whether there are learnings that can be cultivated from what was seen, and whether further investigation is necessary. That work is underway. I have directed the WRHA to immediately put into place additional measures of supervision for this particular operator, and I have been advised that this will be done. It's important right now that there is that good lens being shone on the care provided by this operator, and those plans are being put into effect. I have directed the WRHA to conduct an active outreach to all personal care homes in all the regional health authorities. In essence, we are asking for those who hold the accountabilities in respect of these long-term care homes to fan out and to communicate what they have seen here. We want to do an immediate assessment to know that other long-term care homes are aware and that they are reacting, and that if things are quickly shifting on site from providing chronic care to suddenly providing more acute care, that they know how and when and why to escalate so that help can be on its way. We are directing for the employment of a rapid response capability in our system. And Ms. Siragusa will speak more about that in just a moment. We know that you heard yesterday from system leaders that such a response was already put into place yesterday, responded at Maples, was able to provide care. We are thankful for the cooperation of paramedics in Manitoba who are stepping up and saying this is service and care that we can provide right now. Dr. Friesen says so many times we are all in this together, and it is so encouraging to know that our medical experts are stepping up to say we are there. I spoke, as I said yesterday, to the Executive Director of Paramedic Association of Manitoba, who has assured me that members will be there to help us out to be able to flex quickly and provide the care necessary on site should the ability of a site become somewhat saturated or overwhelmed. We know that plans were put in place some time ago now to solicit for the help of the Red Cross, and I want to remind Manitobans that that help is on the way, that I've continued to ask for updates. I'm understanding that that training is going on right now, and that that first deployment team from the Red Cross is actually still scheduled for Maples, effective Friday. And that will be a resource that will be available to us, not just in respect of Friday, but deployable where the need is beyond that time. And next, I am calling for an investigation of what took place in respect of Maples long-term care home, and indeed also in respect of what we have seen at Parkview Place. As I said, Manitobans need answers. We, in the meetings of the last 24 hours, have heard from system leaders and the operators that the appropriate care was in place, that there were enough nurses, that there were enough others who were providing care, that workforce was not a concern, and that people were being regularly checked. However, there are questions that arise in this kind of situation, and those questions must be answered. And therefore, we will undertake to move very quickly to engage an independent individual with expertise who will be able to enter into agreement with the province to provide an investigation, and that will be for the purpose of determining what went on, providing that independent view into the system, and then to return quickly with advice to system leaders at the Health Incident Command Structure and to government to indicate that if there are things that could be done to assist right now in COVID-19 to make our long-term care homes even safer, even better, then we will do that immediately. Some will say, why not conduct a full inquiry or inquest as a result? And to them I would say, remember that that office of the Chief Medical Examiner is an independent office, but remember, at this point nothing is off the table. And finally, in conjunction with and at the recommendation of the Chief Provincial Health Officer, I am calling for the creation at the Health Incident Command Structure of a task force specific to long-term care. And some may ask, why would you call for that just now? I want to assure Manitobans, we have had that capacity at Health Incident Command Structure. We have had that ability to bring the issues in respect of long-term care and personal care homes to that table. This represents an escalation, and it's an escalation that we are prepared to make at this time. I'll conclude by saying the following. Manitobans need leadership right now. We believe we have been that team to provide leadership during a very difficult time in our province. And when it comes to personal care homes, there really is no place across our system that we have been focused more on. We understand the great vulnerability that our seniors face who are in these long-term care homes. So to the families, I want to say we are sorry for your loss. And if there's something that can be done better in our system to keep those who live at long-term care centers safe, you have my commitment to do it. But we need to solve the problems, and we can only do that if we understand what the problems are. And Manitobans know that we as a team, Team Manitoba, we have faced challenges, and when we have understood what the problems are, we have responded and we have brought the remedy. Think of the way that we quickly moved to make one worker per personal care home in this province. We did that, and we believe that that one measure alone, extraordinary measure, has saved lives. We worked hard when we understood what the challenge was in respect of securing personal protective equipment in Manitoba, and we brought in millions and millions of pieces of the personal protective equipment, PPE, that our healthcare workers would need in this jurisdiction. We worked hard with Doctors Manitoba to understand what virtual tariffs would be necessary to help doctors see their patients even in a pandemic, and just last week we expanded that list. We worked hard when it came to screening sites, and we heard that people were waiting too long in line, and just in a matter of weeks, we've nearly doubled the amount of screening sites that we have in Manitoba, with lineups going down and better service. When we became aware of the fact that there were people who could not get a nasopharyngeal swab because only a few people could administer that, we found a way, working with Red River College, to train more people to do that. I say this in order to indicate just the following. There is an onus on those who operate personal care homes, if they become overwhelmed, to raise the flag and to let us know. I'm not suggesting that things didn't happen very quickly. I'm not suggesting that people didn't need to pivot on a dime. We're hearing things from medical providers that they say are extraordinary in their medical experience, and we need to understand what they've seen. But people like Lanette Siragusa and people like Dr. Friesen at Health Incident Command Structure can clearly only lead if we know what the issues are. In the minister's office, we can lead only so much as we know what the issues are. So we need to all work together as a team. And Manitobans can have the assurance that our team is on this job. We will provide whatever leadership, whatever changes, whatever capabilities in our system that will be necessary to take the steps to prevent such a thing as happened only 24 hours ago and 48 hours ago at Maples. Lanette Siragusa, I'll give the microphone over to you.
Thank you very much. Good morning, everyone. I too would like to express my sincere condolences and sympathies to all the families and loved ones whose lives have been impacted by COVID-19. I was very distressed when I heard of the situation that was happening, along with all other Manitobans, happening within our province and among our most vulnerable citizens at the Maples Personal Care Home. Our job and our priority from the beginning of this pandemic is to do whatever is necessary, whatever is possible, to protect those who are the most at risk and subject to the worst outcomes of this virus. The reports that have been coming out of the Maples Personal Care Home are incredibly distressing, and as a system, we can and we must do better. The personal care home operators must staff their facilities to meet the increasing needs of the residents during COVID-19. Given how quickly this situation has evolved, this does require additional support for contingency staffing plans to ensure that there is appropriate care. To do this, we must immediately put into place supports for those operators that are unable to manage the increased needs of the residents during an outbreak at their facilities on their own. That is why, following the events that we heard about on Friday evening, a rapid response team has now been established to support the immediate response to the facilities that identify or will be identified as needing help. This team will have three main functions. First, it will act as a rapid deployment and intervention resource, able to assess and treat residents and stabilize them within their residence. This will ensure vulnerable residents are able to remain in their home as long as it is safe for them to do so. It will avoid unnecessary transfers to hospital and will support facilities while the situation is being stabilized. This team will include on-site medical support through our emergency response services team. And in Winnipeg, it will consist of a 24-hour staffed ambulance with 2 advanced care paramedics, a 24-hour advanced practice respiratory therapist, and a supervisor or a community paramedic equipped to provide oversight and coordination of care activities and patient needs. We are developing the specifics for a similar team to support rural and northern Manitoba facilities in a similar way. The team's second function is a partnership with the local region, the local health region. Together, the emergency response team and the region will support additional staffing of the facility while a longer-term solution is being established. The health region will provide a nurse practitioner or a primary care physician to join the community and primary care paramedics from Shared Health. This team will have the capacity to provide 12 to 24 hours of support while the Regional Health Authority develops a permanent staffing solution for the PCH. Finally, the team will support a transition back to the facility operators once the situation is stabilized. This team has been established, was on site at the Maples throughout last evening, and with 2 advanced care paramedics there overnight assessing residents and determining the need for transport. A relief team is now on site this morning to continue that work. Before I open to questions, I do want to speak directly to our healthcare workers who are working in those situations that are incredibly challenging. You go beyond the call of duty each and every day, and I know you're tired, and I know you're scared, both for your patients and for your families and for yourself. So we are here to support you. It is our responsibility to ensure that the support you need and the ability to escalate those concerns or any challenges that you experience, it's our job to make sure that those processes are in place and we are hearing you and we are addressing those issues. We remain grateful for the care and compassion and professionalism that you show every single day. And I just want to say, please take care of yourselves. Keep doing what you do, and we're here to help, and I hope that you will continue to take care of each other like you always have, and which is what makes you a great team and great providers, great professionals. So with that, we will open the line to questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 1 follow-up question. Up first, from City News, Jonas.
Good afternoon, Ms. Siragusa, Minister Friesen. First of all, thank you for doing this today on Sunday. Minister Friesen, the first question will be for you today, and I think it's one many in the community will be asking. You've announced a number of steps today, but, I mean, why was not any of these taken earlier? I mean, how did it have to get to this point before this is done?
It's a fair question. Thank you for the question. Thanks for being here today. So action has been taken. and action has continued to be taken throughout this pandemic. We are not immune to COVID-19, and neither are our systems immune to the effect of COVID-19 and the effects on them. That's why we worked as hard as we did, and system leaders worked as fast as they did to prepare for COVID-19 in our care homes. The fact of the matter is this, is that when COVID-19 gets into personal care homes, it can have a devastating effect. We have 19 care homes right now that have outbreaks. There isn't a province in Canada that doesn't have an outbreak right now. It's why we took some of the measures that I referred to just previously. It's why we've worked hard to understand what's going on here. I want you to know that when we started to see what we saw in respect of Parkview Place and Maples, I actually called for regular briefings to be provided to me at my office with all of the appropriate persons and agencies at that table. And so we've had those meetings with the Deputy Minister, with the WRHA CEO, with the Director of Long-Term Care in the WRHA, with others at that table to discuss what's happening, what steps have been taken. And I want to be clear that my most recent briefing in respect of Maples was on Thursday morning at 8:15. And there was nothing provided to me at that briefing that would have led me to believe that somehow that situation was in imminent danger of deteriorating. So that raises important questions about what was going on at an operational level. I can tell you that when it comes to our assessment of the situation, the operator has said that the nurse complement was appropriate and even exceeding what was required, that there were healthcare aides and other workers on staff, and that the residents were being checked on an hourly basis. I can tell you that my notes from Thursday in that briefing that I received talked about PPE being evident and housekeeping taking place, that the fact that hospital transfers were following established protocols. I can tell you that they referred to the inpatient physician assessments that were ongoing, and they said the Red Cross is arriving and will be on site in less than a week. And there was nothing provided to me at the time to indicate that it was otherwise. So now that raises questions, and we will get to the bottom of those questions.
And as a follow-up, sir, you addressed it earlier. Long-term care homes were one of the first hardest hit in other provinces, whether it be Quebec, whether it be Ontario, and it could have been probably a matter of time before it got here. Now, what I'm interested in is the agreement between private for-profit personal care homes like Rivera and the province. When are you actually able to undertake facility reviews, and what is the agreement between the private facility and the WRHA, and when you can go in?
So to be clear, the provision of care by a long-term care provider is through the regional health authority and not to the minister, so that accountability is held at the regional health authority level. And then, as you say, it is the service delivery arrangement that we do reserve the right to go in and inspect and to do unannounced follow-up reviews. And these things are in place, both in respect of the Rivera homes and others across our system. In fact, as you know, there was a scheduled review of Maples only very recently, and then a follow-up review that was only undertaken on Monday. So that assessment and oversight of personal care homes exists in Manitoba. We have a strong system for the review to make sure that these homes are up to standard, and when they aren't, that plans are undertaken to ensure that they get there.
From CHVN, Taylor.
Hi, good afternoon. Minister Friesen, can you talk to us more about the gravity of the situation, why you decided to hold a press conference on a Sunday, which is pretty unusual?
I believe Manitobans needed a very quick response. That's why I directed that those system leaders and Rivera would be here in room 68 yesterday at 5:30. I also knew that essentially all accountabilities are up to the minister's office. I thought it would be appropriate for Manitobans to know that the minister and the health incident command structure are on the job. And I thought it would be important today to reassure Manitobans that even in the short time that has proceeded since that situation, already plans have been made for immediate and interim response.
And Lanette and Minister Friesen, seeing everything going on at Parkview and at Maples, would you feel comfortable having family at these facilities?
I'll speak to that first, and I'll invite Mrs. Siragusa to do so as well if she'd like to. So as we said, we know from the global experience, and we know here in Canada, that long-term care homes are challenging places to protect during a global pandemic. We just know that in every jurisdiction. It's why we've taken the exceptional set of actions we have in this province, actions that we really believe have kept people safe. But, you know, errors occur and things happen, and it's hard to wear PPE exactly correctly, and visitation produces risk, but not visiting creates risks as well of a different kind. And so that is why we are acting as we are. I don't think there's any indication I've ever received by any of our leading officials, any of our, regions, that somehow they don't have a full focus on safety at personal care homes. I think the tragedy in Canada is that despite the best efforts, still COVID has gotten into personal care homes. And that's why today, with this set of actions, we are indicating that if there is something to be learned from this event that took place at Maples, we're going to learn that lesson and fast and put into practice additional measures to keep Manitobans safe.
From the Winnipeg Free Press, Ryan.
So we've got at least 23 deaths at Maples. We got 8 in a period of 48 hours. By my count, at least 121 residents and 55 staff that have tested positive for COVID-19. We got the situation deteriorating to such a significant degree that paramedics are on scene for 7 hours. This paramedic whistleblower describes it as a nightmare. And we got families reporting a lack of staff and inadequate care of residents. And the WPS has confirmed that they're taking a look at this situation. The province is not stepping in and taking over operations at this personal care home. Why not? If not now, when? What would it take? And Minister Friesen, are you comfortable telling Manitobans that you continue to have confidence in Rivera to operate this facility competently and safely for residents?
First of all, I'd say none of us are comfortable with this situation. None of us are comfortable with what we became aware of only so recently. On the second question of what would constitute the basis to take over a home, that's why we will do an investigation. We're going to understand what are the claims that the operator is making in respect of the staffing at the time of these incidents. What was happening medically? Nurses have exceptional experience and capacity to treat patients who are chronic care and their residents who are chronic care, nurses in long-term care homes, that is. And when the situation turns to an acute situation, if that happened very quickly, what was their capability and how did they respond? The investigation will determine next steps, even in respect of the things that you're raising. I would want to make clear to Manitobans, as we've said before, there's nothing that we've taken off the table.
I know, but now it's coming on me. Okay.
What is the timeline on this investigation? And also, we have a photo of what appeared to be a body being taken out on a stretcher from Maples last night. Have there been additional deaths at that facility that have not been reported to the public yet?
It's almost better just to get a family
Sorry, I'm getting some background noise. Okay, thank you for the question. So on the second question, I'm unaware of new deaths at the home subsequent to what we've just now reported. I could get an update to clarify that. Perhaps one will be provided at this table. And then will you just repeat the other part of the question?
What's the timeline on this provincial investigation? When can we expect it to be launched, and when can we expect it to wrap up?
Yeah, so rapid. because we need answers now. And that is why I'm undertaking this measure, an investigation, an examination of what took place in this circumstance, and then a reporting back of what took place, an exploration of the evidence and information that's been provided. We want to test that. And then we want to know if there are system learnings because of what we've said what we've been told were extraordinary conditions that evolved very rapidly at the personal care home. So soon, and the details of this will be provided to Manitobans soon, and the reporting back of this investigation to my office and then made public also soon.
From Global, Eric.
So in the past 6 months or 8 months since the pandemic began, we've known that personal care homes are a vector for this disease. Why were there not measures put in place prior to the second wave here in Manitoba that would have prevented these deaths?
So in the spring, we saw what was happening in personal care homes in Ontario and Quebec, and the Public Health Agency of Canada wrote up recommendations as to how to keep those long-term care facilities safe and what kind of things we could do in order to prevent the spread or the outbreak situation. So as you know, like we had the visitor restrictions were quite severe in the spring when we started. We loosened that up because we saw that there's risks and there's benefits with not allowing caregivers to be close to their loved ones, and we still believe that. We have went through every recommendation from the Public Health Agency of Canada. We met with leaders throughout the region in long-term care to make sure that every recommendation was being addressed. We have incorporated them into our guidelines that have been distributed, and I would say also the private personal care homes would have received those guidelines too as part of the implementation process. So we have done everything that we can to prevent this from happening. We know it's a risk. We're in a pandemic. We know it's a risk. So if we can prevent it, that's great. If it happens, we have to work really hard to contain it. And the other thing that I've been talking about this week that's really important is that we want to have a provincial system response, but we also have to rely on those local providers to manage the resources from within and escalate to a regional level or a provincial level if more help is required. And not knowing all the details of this situation, it sounds like they were staffed appropriately for normal operations, but this was not normal. This was more acute, and more reinforcements needed to be there. So I think we've done everything we can think of to prevent COVID from getting into these communities. I think we need to refine our processes and just keep working at getting better and making sure that all the parts of the system are working together to address the situation.
Minister Friesen, 22 people are dead within the past 2 days. Do you take responsibility for this? I mean, I know, of course, it's the virus, it's spreading the home, but you are the health minister. What could you have done better to prevent this?
I would say it a little differently. The accountability is mine. I am the minister. The accountability is mine. I hold that accountability to my premier, to my cabinet, and indeed to all Manitobans. And so the buck stops at my office. And so that is why every day we're on the job, working as hard as we can, going flat out, talking to people in our jurisdiction, relying on our leadership, giving good information to Manitobans, putting in place the things that need to be put in place to keep Manitobans safe. That's not easy for anyone, and I am honored to be part of the team that I am part of. So what we can do is more, and we have committed to do that today. We saw some extraordinary circumstances in the last 36 hours. That evolved very quickly. We have responded, but we will respond more. That's why the investigation. That's why that rapid response team. That's why the Red Cross is arriving and starting in 5 days. That's why we've directed for the additional active outreach to all personal care homes. That is why we are calling on this new task force to sit at the Health Incident Command structure and give specific leadership, even in a more elevated way than before. I hope that helps to answer the question. Manitobans have a right to believe that this team is doing all they can to keep people safe, and that's the assurance that I can give.
From the Brandon Sun, Tyler.
Hello, sir, folks. Thank you for taking the inquiry. Now, thinking about Daughter on Call, private care home in Brandon and Westman that saw multiple health infractions reported early in the pandemic, including locking out inspectors at one location. They've been fined, but now, given what's happening in Winnipeg, I'm concerned about the follow-up. First off, what kind of follow-up might have taken place? Maybe not this place specifically, but what kind of follow-up did take place, and will follow-up change with the plans announced today?
So I would just want to be clear that the organization that you named does not provide care in Manitoba's long-term care homes. My understanding is that that agency provides care in assisted living complexes and other places. So I think you are correct that there were some actions undertaken earlier, and I don't know what the follow-up was specifically in respect of that agency you named, but we could follow that up for you.
And you'd mentioned additional supervision at the operator. Now, is that Maple specific or all Riviera? Because I'm thinking that Brandon has a Riviera. I'm sure that other locations in Manitoba have a Riviera care home.
Yeah, not either or, but both and. So I have recommended, I've directed the WRHA to provide additional supervision of those sites, but I will also receive advice as to what level of additional supervision based on evidence would be necessary at other sites operated by this particular operator.
From the Winnipeg Sun, Glenn.
Yes, Mr. Minister, Glenn Dawkins from the Winnipeg Sun. While I respect that and they're gathering information, we've heard from families who would like action now. Why is not the province considering some kind of a takeover of Naples while this review takes place? Or has that been considered by the government?
So action now is exactly what Manitobans are getting in respect of the direction that I've given to actively outreach to all personal care home providers to say there are things you need to watch out for as care can move from more chronic to acute, and we need to watch medically for that. There is response immediately in terms of this rapid response unit that actually yesterday, even within 24 hours, was already operational and providing care and activated. So thank you to all of those who have helped already to provide that response. And then care and action right now is also being promised in terms of an investigation that will take place that will report back post-haste and provide information and direction about next steps.
At the press conference last evening, the vice president from Rivera indicated that the staffing level was satisfactory, adequate. We've gotten word from the Manitoba Nurses Union that they dispute that there's been, I believe, 47 reports of working or staffing reports from Maples, 3 times as many as there were last year. Does this give you pause to look at those staffing levels?
So I want to be clear that the information from the operator was that nursing levels were adequate and in excess of 100% to meet standard, and then also healthcare aides and other general workers on site. I understand yesterday, I believe maybe 13 healthcare aides and an additional 15 other support workers. We've also heard and had this affirmed by WRHA LTC, long-term care, that staffing was adequate. But this is why the investigation. This is one of the things that will be determined. We are being told this, but clearly less than 24 hours before paramedics were responding, I was also informed that things were stable. And that is why now this investigation to determine if we had all the information that we needed to have in order to act. And as we've said before, we can only act if we have information.
From CBC Manitoba, Holly.
Hi, Holly Carrick here with CBC Manitoba. I'm just wondering, have geriatric specialists previously reached out to the province or the health region to offer support and advice for personal care homes, and what was the response to that?
Which geriatric specialists are you referring to?
Have there been doctors or experts that have contacted the province or the health region to talk about what some of the best practices should be, and were they responded to?
Oh, I can assure you that we are in contact all the time with system leaders. Lanette Siragusa referred to the Public Health Agency of Canada that wrote a whole compendium of information for use at personal care homes. We are all learning as we travel through this pandemic. I assure you that practice at personal care homes has even evolved in the last 6 months, just knowing what we know about the virus. And so, yes, I would say we continue to receive advice, and we continue to be in contact with system leaders, not exclusive to geriatricians, but also other specialists and medical providers throughout both the province and throughout Canada.
Thank you. And my follow-up, it's been mentioned that there's 20 Red Cross workers who might be in place as of Friday. And if those workers are needed there, if there's tasks that they're needed to do, why is the WRHA not providing those workers? Why are we waiting until Friday?
Well, we're not waiting until Friday. So we made the call. It was my advice as well to the WRHA that the Red Cross needed to be engaged. We need to understand that, and Lanette Siragusa reflected on this, that this has had an impact in personal care homes, not just on residents, but on workers. We know right now that at Maples, you've got 50+ staff who are isolated or sick by COVID-19. So this creates a real impact on our ability to be able to, on the ability of the operator to be able to staff at that site. Then, in addition to that, those restrictions that have had to be loosened in some cases that are trying to prevent the importation of the virus to the personal care homes by disallowing a worker to move between homes has been another limiter. So that is why these are real challenges in real time that have had to be attended to. That's why we're shaking that tree to say, what other resource is available that can help right now? That's why the paramedics today, as a rapid response form of action, that is why the Red Cross, that is why the nurse practitioner and additional physicians that are on site, and that is why we will continue to build in that direction to be able to provide the care models and the staff that are necessary to respond.
From the Canadian Press, Steve.
Oh, hi. Steve Lambert from the Canadian Press. The we learned yesterday that when the paramedics were called, they had to treat some residents on site with IV, including for hydration. I'm not a medical expert, but to my layman's mind, am I correct in assuming that paramedics treating people with IVs for hydration is a red flag, a sign that there was a lack of care that wasn't just over the course of an hour or two, that this points to something more fundamental?
Well, I'll say this. I am neither you nor I is a medical expert, but I know what my medical experts are telling me. This is why the investigation, like we're being told anecdotally, that people can go downhill fast who are so frail. Remember, these are our frailest patients who are in long-term care, and some of these at end of life or with COVID-19 and approaching end of life, and then a rapid decline is being observed. However, we have the facility operator telling us that these residents were being monitored appropriately and on the right interval. But that is why the investigation, to determine exactly as you are asking, what that meant and what that level of response at that time by paramedics suggested.
And you said you had a briefing Thursday, and you were, led to believe that things were not as dire as we found out Friday. Is the government relying on self-reporting too much? Is there a need for the government to go into these homes more frequently and independently obtain information?
So this was not a self-report by the operator. This was a report in respect of a regular report provided to the Minister and the Deputy Minister of Health by the WRHA, by long-term care leadership in that area. This is why, in answer to your question, we are undertaking to provide this investigation to determine what had happened. But as I said before, nothing is off the table in contemplating next or additional steps.
From CTV Winnipeg, Michael.
Yes, hello. My question is also about staffing. We heard from the Rivera Regional Director yesterday that staffing was at capacity, if not exceeding it. You said that you've heard the same, Minister Friesen. My question is, are these staffing levels based on a pre-COVID guidelines, or in another word, has staffing requirements changed to meet this new pandemic reality?
That's a really good question. I don't know who you're asking, but I'll jump in with the answer. So same as you, we heard that there was adequate staffing. I would say that adequate staffing is most likely based on normal operations in a personal care home where they may be dealing with chronic disease or palliative care, but not necessarily the acute situation that COVID brings and the rapid deterioration that obviously happened in this situation. So this will have to be part of the investigation, and it is part of our action as of right now that we need more people supporting this site, supporting these residents, in this time of their healthcare needs. It's not normal personal care home business right now. It's a COVID outbreak. So it's a really good question, and we will provide enough support, as much support as these residents and the staff require at this time till they are stable, and we will. Going forward, any PCH that has an outbreak, we have to be able to respond quickly. We need to know there's a situation, and we need to respond quickly with the right resources so that we can provide the adequate care. And that may be transferring out, it may be supporting them in the personal care home, but that's I think the biggest lesson here is looking at what are the needs of the residents and what is the capability of the staff, not just the number of nurse-to-patient ratio, but the complexity of the care we have to consider.
Thanks for that. And then my follow-up to whoever can answer is what was specifically that nurse-to-patient ratio at Maples on Friday night, excluding, support staff and specifically nurse-to-patient ratio?
The operator has informed the region that the hours per patient per day was reached and exceeded. So the full complement of staff, according to that ratio, as the operator reports, it was in place.
Thank you, everyone, and this concludes our media briefing.
Thank you.